Welcome to the Deep Dive. Today we're going to be taking a deep dive into the healthcare system of Haryana.
Haryana.
Yeah.
Yeah.
It's a state in India.
Right. Yeah.
And, at first glance, you think, okay, well, India is a developing country. But Haryana is actually one of the more economically developed states in India. So that's kind of an interesting contrast, right?
Yes, definitely.
You've got this booming economy.
Yeah.
But when you look closer, there's some serious questions about, is everybody benefiting from this prosperity?
Yeah.
And that becomes even more apparent when you look at healthcare.
Absolutely.
So
Yeah.
the sources you sent me were really fascinating.
Oh, good.
And it seems like
Yeah.
the big question here is, can a region really be considered developed if a big chunk of its population doesn't have access to good health care?
It's a great question, and that's exactly what's so interesting about Haryana. It's a really microcosm of this challenge of, economic development versus equitable access to healthcare.
Okay.
Yeah.
So on one hand, you've got these incredibly advanced private hospitals.
Right.
Attracting people from all over the world.
Medical tourists from all over the globe.
Yeah, exactly.
Yeah.
But then you've got rural communities
At the same time.
struggling to get even basic care.
Right.
So it really is a tale of two systems.
Yeah, it's a real paradox.
Yeah.
And I think that's why this deep dive is so important.
Yeah.
Because it's not just about Haryana. It's about a question that a lot of places are grappling with.
Absolutely.
Yeah.
So if you were living in Haryana, would your healthcare experience be world-class
Right.
or a struggle for the basics?
It really depends on where you live
It sounds like it.
and what you can afford.
Yeah.
Yeah.
So let's start with the public healthcare system.
Okay.
The sources you sent me mentioned that there's a three-tiered structure.
Right. Yeah.
You unpack that a little?
Sure. So imagine, a pyramid.
Okay.
Okay. And at the very top, you have your tertiary care centers.
Okay.
These are your major hospitals like AIIMS, Chadchar, PGIMS, Rotak.
So those are the big ones.
Yeah, these are the high-tech specialized facilities.
Got it.
And they tend to be concentrated in cities like Gurugram, Faridabad, Panchkula.
Okay, so that's where you'd go
Right.
for like heart surgery, cancer treatment, that kind of thing.
Exactly. Those are the places you'd go for the serious stuff.
Okay, so one level down,
Yeah.
you've got the district and sub-district hospitals.
That's right.
And those are intended to serve.
Both urban and sort of semi-urban areas.
Yeah.
And they provide a wider range of services than the smaller clinics.
Okay, so if you need something more than like a basic checkup,
Right.
but it's not like super specialized, you go to one of those.
Exactly.
Yeah.
And then at the base of the pyramid,
Okay.
you have your primary health centers, the PHCs,
Mm-hmm.
and then community health centers, CHCs, and subcenters. And those are really the front line, especially in rural communities, offering basic medical care and preventative services.
So it seems pretty logical.
Yeah, on paper.
On paper.
Yeah.
But reading through these sources,
Yeah.
I get the sense that there are some pretty big cracks in this system.
You are absolutely right.
Yeah.
And, I'd say the biggest crack is probably the one between urban and rural healthcare experiences.
Yeah.
So imagine needing critical care and the nearest equipped facility is hours away.
That's scary.
That's the reality for many people in Haryana.
Yeah.
So that kind of highlights how even though the system might look good, like in theory on paper,
Right.
the actual reality on the ground is very different.
Yeah.
And it's not just about distance.
Mm-hmm.
We also have to think about the resources available at each level.
Right.
So yes, those tertiary hospitals
Yeah.
tend to be well equipped. But when you look at the PHCs, particularly in rural areas,
Yeah.
many of them are facing shortages of essential medical supplies
Yeah.
and diagnostic equipment.
So even if you can reach a clinic,
Right.
there's no guarantee that they can actually help you.
Exactly.
Yeah.
It's a big problem.
From what I read, it seems like the government have all these programs to try to, improve healthcare in Haryana. Is it just not enough?
That's a good question.
Yeah.
I don't think it's that the government isn't trying. They have rolled out initiatives like the Chirayu Haryana Yojana,
Okay.
which is a health insurance program.
Right.
And then there's the Mukhyamantri Muft Ilaj Yojana,
Okay.
which offers free services in government hospitals.
Okay.
There's also the Haryana Health Protection Mission, which is focused on strengthening facilities.
Yeah.
And then specific programs for maternal and child health care.
Right.
And even telemedicine.
Okay.
And digitizing health records.
So they're trying different things.
Yeah. There's a lot of initiatives on paper.
Okay. But it sounds like you're saying the impact.
Well, the question is,
right.
Are they really moving the needle?
Right.
You know, for example, the Chirayu Haryana Yojana, it aims to make healthcare more affordable.
Right.
But are people actually using it?
Right.
Are there bottlenecks in enrollment or reimbursement that are limiting its effectiveness?
Yeah.
And even with free services, if the nearest clinic doesn't have basic equipment, what good is it?
Yeah, that's true.
So, you know, these are the deeper questions that we need to be asking.
Right.
Yeah.
Yeah, it's not just about having programs in place.
Exactly.
It's about making sure that they're actually working.
Right.
And that they're reaching the people that they need to reach.
And that they're addressing the root causes of the problems. Yeah.
And we can't forget about the human factor, right?
Absolutely.
Like, what is it actually like
right.
to be, you know,
for the people who are
the person who has to travel for hours to get to a clinic that maybe can't even help them.
Exactly.
That's got to be incredibly frustrating.
It is. And those are the stories that we need to understand to really grasp the situation.
Yeah, the data is important. The policies.
Absolutely.
But it's only part of the story.
You're right.
We really need to hear from the people to get the full picture.
I agree.
It's almost like there are two different healthcare universes operating in Haryana. One modern and expensive, and one that's really struggling to meet basic needs.
Absolutely.
It's a tough situation.
It is.
Yeah.
It is. It really is. It's like two parallel worlds almost.
Yeah. And speaking of those two worlds, the sources kept mentioning Gurugram as like this healthcare hotspot.
Yeah.
What makes it so different from the rest of the state?
So Gurugram is really interesting because it kind of embodies that other side of Haryana's healthcare story. It's become a real hub for medical tourism.
Wow.
You know, attracting patients from all over India and even internationally.
Wow.
You have these massive super specialty private hospitals there, like Medanta Fortis Artemis, offering, you know, cutting edge treatments and technology that you wouldn't find in a lot of other places.
So it's almost like a world-class healthcare destination?
Yeah.
Like within Haryana?
It is.
That's wild.
Yeah.
But doesn't that kind of just exacerbate the problem?
No, it does.
Yeah.
And that's the paradox.
Yes.
Because while Gurugram shows what's possible with private healthcare, it also really highlights that issue of affordability.
Right.
You know, these private hospitals, they're great if you can pay for them.
Right.
But for a lot of people,
for the average person,
they're just completely out of reach.
Out of reach.
Yeah.
That makes me think about something you said earlier.
Yeah.
About the shortage of healthcare workers in those rural areas. Do you think that this concentration of private hospitals in Gurugram,
it's possible. It's kind of pulling talent away from the public sector.
Yeah.
It's definitely a factor.
Yeah.
You know, a lot of doctors would prefer to work in these urban private hospitals.
Where the pay is better.
Where the pay is better. The facilities are more advanced.
Yeah.
And so attracting and retaining specialists in those rural government hospitals.
Yeah.
It's a huge challenge.
So it's not just about like building more hospitals.
No, it's about the people.
And clinics.
Yeah.
It's about getting healthcare workers to those places.
Exactly.
Yeah.
Incentives are a big part of it.
Yeah. And I guess incentives aren't just like salary.
No.
Right.
It's about creating a supportive work environment.
Right.
You know, providing opportunities for professional development. Yeah. Making doctors and nurses feel valued, respected.
Yeah. And of course, we can't forget about the patients.
Absolutely not.
How are they impacted by all of this?
Right.
You know, it must be so frustrating.
Yeah.
To know that this world-class healthcare exists in your state.
Yeah.
But you can't access it.
It is a source of immense frustration.
Yeah.
And it really fuels the sense of inequality.
Yeah.
And it's not just about the financial barrier. Even if someone could afford treatment at a private hospital in Gurugram, the distance itself can be a major obstacle.
Especially for people in really rural areas.
Exactly. Yeah. So you might have the money, but you still face those same challenges.
Of distance.
Of travel time and access that we were talking about earlier.
Yeah, so we've got this shortage of healthcare workers.
Yeah.
Concentrated in these urban centers.
Right.
High costs in the private sector, and then the public system struggling to keep up.
It's a lot.
Yeah, where do we even begin to unravel this?
Yeah, that's the question.
Is there any hope?
There is hope.
Okay. One of the things that people are talking about
as
a potential solution is public-private partnerships.
Okay. PPPs.
PPPs, yeah.
Can you explain what a PPP is?
Sure. So it's essentially a collaboration between the government and private companies.
Okay.
So in the context of healthcare, it could mean the government offering incentives to private hospitals to encourage them to expand into underserved areas.
So like tax breaks or subsidies or something like that.
Exactly. Or even help with building new facilities.
Right.
It's about leveraging the resources and efficiency of the private sector to reach those populations that the public system is struggling to serve.
Yeah.
So for instance, instead of trying to build, expensive specialty departments in every district hospital, the government could partner with private hospitals to offer subsidized diagnostic services or specialist consultations in rural areas. So it's kind of like working smarter, not harder.
Exactly.
Yeah.
Yeah.
That sounds promising.
Yeah, and it can also be used to improve things like ambulance services in rural areas, making sure that people have access to timely emergency care.
Which is so important when you consider the distances people have to travel.
Yeah, it's not about replacing the public system.
Right.
It's about creating a more effective and comprehensive network by combining the strengths of both public and private.
This all sounds really good.
Mm-hmm.
But I'm sure there are downsides.
Of course.
Yeah.
I think one of the biggest concerns is accountability and quality control.
Yeah.
It's crucial to have strong regulatory frameworks in place to make sure that private providers are maintaining high standards of care.
Yeah, you don't want them to just be prioritizing profits over patients. So it's like it has to be a real partnership.
Yeah, it's going to be a true partnership, not just handing over responsibility.
Right, and hoping for the best.
Right. Exactly. And we also have to remember that PPPs aren't a silver bullet. They're one tool.
One tool in the toolbox.
In the toolbox.
Yeah.
And to really address the healthcare challenges in Haryana, it's going to take a multi-pronged approach.
Right.
And that brings us to another really exciting area.
Okay.
Digital health.
Oh, yeah. I was wondering when we would get to that.
Yeah.
I've been reading a lot about how telemedicine and these other digital health initiatives are really transforming healthcare.
They are.
Especially in rural areas.
Especially in places where access is limited.
Could this be a game changer for Haryana?
I think it has the potential to be.
Okay.
Yeah. Imagine a patient in a remote village who needs to consult with a specialist in Gurugram. Instead of traveling for hours, they could have a virtual consultation through a telemedicine platform.
Yeah, that would remove such a huge barrier.
It would.
Yeah.
And it goes beyond just consultations, too.
Okay.
Telemedicine can be used for remote monitoring of patients with chronic conditions, providing educational resources, even training for healthcare workers in remote areas.
That's amazing.
Yeah, it really opens up a lot of possibilities.
Yeah, it sounds incredible.
Yeah.
But is Haryana ready for this?
That's the key question.
Yeah.
While the potential is there, success really depends on several factors.
Okay.
First, you need reliable internet connectivity.
Right, which I imagine can be a problem.
Which can be a problem in some rural areas.
In some rural areas, yeah.
Yeah, exactly.
It's hard to have a virtual consultation if you can't even get online.
Exactly. And beyond the infrastructure, you also need to make sure that healthcare providers are trained in using this technology and that patients are comfortable with this mode of care.
So it's not just about having the technology.
No, it's about the whole ecosystem.
It's about the system.
Yeah.
Yeah.
And And digital health goes beyond telemedicine. We're talking about electronic health records, mobile health apps.
Right.
All these tools can play a role
Yeah.
in improving efficiency, coordination of care,
Yeah.
patient engagement.
It's like building this whole...
It's about a connected healthcare ecosystem.
Connected healthcare ecosystem.
Yeah.
This is all very cool. But it makes me wonder.
Yeah.
Like, can technology really fix this?
That's a great question.
Like all these deep-rooted inequalities that we've been talking about?
Yeah, technology is a powerful tool.
Yeah.
But it's not a magic bullet.
Right.
We can't forget about the social and economic factors that contribute to health disparities.
Yeah, like poverty.
Exactly.
Lack of education, sanitation.
Yeah, all those things.
All those things.
Absolutely.
Yeah.
Addressing those underlying factors is essential.
So we're talking about like a complete paradigm shift.
I think so.
Yeah.
Moving beyond just treating illnesses to actually creating a healthier society.
Yeah.
Yeah.
So as we kind of wrap up this part of our deep dive, it feels like we've explored all these challenges.
Yeah, it's complex.
There are no easy answers.
No.
But there are these,
there are some glimmers of hope.
These glimmers of hope
Yeah.
in these new approaches.
Yeah, I think so.
So where do we go from here?
Yeah, what does the future hold for Haryana?
Yeah. Yeah, it really does feel like we've uncovered a lot in our deep dive into Haryana's healthcare.
It's a complex system.
Yeah, it is.
For sure.
We've seen this, stark contrast between this thriving private sector and the public system that's really struggling to keep up.
Yeah.
We've talked about some really interesting solutions like PPPs, digital health.
Yeah, those hold a lot of promise.
They do.
Yeah.
But I guess the question is, where does Haryana go from here?
Right. What does the future hold?
What does the future hold?
That's the big question, isn't it?
It is.
I think, for Haryana to really make progress, they have to shift their perspective from just treating illness to creating a culture of health and well-being.
That sounds like a pretty big shift.
It is, but I think it's essential.
Yeah.
And it starts with education and awareness.
Right.
We need to give people the knowledge and the tools they need to make healthy choices.
So, like, what kind of tools are we talking about?
Well, for example, promoting healthy diets, encouraging regular exercise, raising awareness about the risks of things like smoking, excessive alcohol consumption.
So it's really about moving beyond reactive care to like a more proactive approach.
I think so, yeah.
Focused on prevention.
Prevention is key.
Okay.
And it's not just about individual behavior either.
Right, because you can make healthy choices.
Right.
But if your environment doesn't support that.
Exactly. You need to create environments that support those healthy choices.
Yeah. So what would that look like?
Well, investing in parks and recreational facilities. Making sure that fresh fruits and vegetables are affordable and accessible.
Right.
And reducing exposure to environmental hazards like air pollution.
So we're talking about a lot of different things here.
It's multifaceted. Yeah, it's a whole system approach.
Right.
And we also can't forget about those social determinants of health we talked about.
Yeah, poverty.
Poverty, lack of education. Inadequate sanitation.
All those things.
Yeah, all of those things play a huge role in shaping health outcomes.
It's not just about building more hospitals.
It's about building a healthier society.
Right.
Yeah.
So what would you say are like the key indicators that Haryana is moving in the right direction?
That's a great question.
What would success look like?
I think for me, one of the most important things would be a reduction in those health disparities between urban and rural areas.
So closing that gap.
Closing the gap.
Between those two healthcare universes.
Yeah, exactly. Everyone should have access to quality care.
Yeah.
No matter where they live.
Regardless of how much money they have.
Exactly.
Yeah.
I'd also like to see a greater emphasis on preventative care.
Okay.
People should feel empowered to manage their own health. And we should see more resources dedicated to early detection and intervention.
Which hopefully would lead to, fewer cases of those lifestyle diseases.
Exactly. Yeah. And finally, I think a successful healthcare system in Haryana would be one that is much more integrated and coordinated.
So the public and private sectors.
Working together seamlessly.
Together.
Yeah, sharing information.
Yeah, it's not just about fixing what's broken.
Right.
It's about creating something new.
It's about building a better system.
Yeah.
A system that really puts the needs of the people first.
This has been really eye-opening.
It's a fascinating case study.
It is.
Yeah.
What would you say is like the most important takeaway from all this?
I think the biggest takeaway for me is that healthcare is not just about hospitals and doctors.
Right.
It's about creating a society that values health and well-being.
It's about everything.
It's about everything.
Yeah.
It's about empowering individuals, strengthening communities, investing in a future.
Where everyone has a chance.
Where everyone has a chance to be healthy.
Yeah, that's a powerful message.
It is.
And it's a good reminder that we all have a role to play in this.
Absolutely.
Whether it's, our own personal choices or advocating for better policies or supporting organizations that are working to improve health.
I completely agree.
Yeah.
It's a collective effort.
It is.
And it's an effort worth making.
Haryana's healthcare system is at a crossroads.
Yeah.
The choices they make today are going to affect people.
For generations to come.
For generations to come.
Yeah.
The potential is there.
It is.
But it's going to take real vision and commitment.
And a willingness to embrace new ideas.
Yeah.
Yeah.
So as we wrap up this deep dive, we invite you to think about, what aspects of Haryana's healthcare story really resonated with you.
Right. What stood out to you.
Yeah, and what insights are you going to carry forward?
Yeah.
We'd love to hear from you.
Yeah. Thanks for joining us.
Thanks for listening.